Okay, welcome back. I just want to comment briefly on something that I forgot to say about cocaine withdrawal. Um, we talked a bit about the letdown that folks experience, but when an individual stops using, cocaine or at the end of that, at that letdown period, the depression that is a result of that letdown or that crash can persist for weeks or months. And so, one of the things that we're going to see across cocaine and amphetamines is that the depression that results from the use is very long lasting. Okay, and I think, as I mentioned in the cocaine segment, clinical. Okay, so here let's talk about administration and distribution of the amphetamines. Okay, and so depending on the desired effects or the purpose for which the drugs are taken, the route of administration may vary. Okay, so amphetamines can be injected or inhaled, okay, smoked and inhale the vapors, etc. Generally, when individuals are using them for the euphoric effects, then the injection or the inhalation are the preferred modes of administration. And when we talk about oral administration, this more commonly with things like Ritalin and the amphetamine derivatives that are used for treatment of ADHD, ADD. Okay, but you'll see historically that when these were used to give soldiers energy, delay the onset of fatigue, then these things were given orally. You used to see a lot of amphetamine use in truck drivers and people who had to drive for extended periods of time who did not want to get tired, and so you would see the oral route of administration when when the individual is more concerned about delaying the onset of fatigue, or when you're looking for effects other than the euphoric effects that are associated with the amphetamines. Okay, so when these drugs are taken orally, there are two things that can affect the rate of absorption. One you should already be thinking about, that's whether or not there's food in the stomach. Okay, because remember, whether or not there's food in the stomach is going to determine how quickly your stomach dumps its contents into the intestines. And so on an empty stomach, the contents are dumped more quickly, but they're dumped more slowly. Okay, it takes longer for the stomach to dump its contents if there's food in the stomach. Okay, so the effects would be experienced more rapidly on an empty stomach than a stomach that contains food. Okay, the second thing that would affect the rate of absorption is actually physical activity. Okay, because if an individual is engaging in physical activity, then you have increased blood flow, and the increased blood flow would facilitate the absorption of the amphetamines when these things are taken orally. Okay, now distribution similar to cocaine. Here blood levels, peak blood levels reach between 30 minutes, but here it's 4 hours. So one of the big differences between cocaine and the amphetamines is the effects of amphetamines last a lot longer. Okay, but similar to cocaine, the amphetamines cross the blood-brain barrier and they become concentrated in the spleen, kidneys, and the brain. Okay, all right, and in terms of excretion, also similar to cocaine, the pH of the urine is going to have a significant effect on the excretion of amphetamines. When the urine is acidic, amphetamines, which are weak bases, are going to ionize, which means they become trapped in the urine, which means that they cannot re-enter circulation. So again, the pH of the urine is going to have a significant effect on the excretion of amphetamines. Okay. Similarly with amphetamine metabolites. Okay, but one of the things here that we want to recognize is that because the effects are so long lasting, part of that is due to the active metabolites. Okay, so now let's talk about how the amphetamines do what they do. Okay, neurophysiology. how are they working in the brain to produce the effects that we associate with their use. Okay, so the first thing that we want to mention is the thing that they share in common with cocaine is they block the reuptake. Okay, they block the reuptake of dopamine and block those autoreceptors. Okay, so again, they block the reuptake of dopamine and the other monoamines really, but they primarily block the reuptake of dopamine and the other monoamines, and they also block those autoreceptors. Okay, so there are a few other things that amphetamine does that are a bit different from how cocaine produces its effects. One is that the amphetamines are able to increase the spontaneous leakage of neurotransmitter from the presynaptic neuron. Okay, so why is that important that we're saying the spontaneous leakage of neurotransmitter from the presynaptic neuron? Because remember, under ordinary circumstances, neurotransmitter should only be released after the arrival of an action potential at the end of the axon terminal. Those synaptic vesicles would burst open and dump neurotransmitter into the synapse. But here we're saying that the amphetamine drugs have the ability to increase the spontaneous leakage of neurotransmitter from the presynaptic neuron. So one of the things that the amphetamines are able to do is that they're able to bind to those autoreceptors, okay? But part of what the amphetamines are able to do that's different from cocaine is that those amphetamines are actually able to enter the presynaptic neuron. And then amphetamine itself gets released as if it were a neurotransmitter from the presynaptic terminal. So this is one of the ways that you increase that spontaneous leakage into the synapse, okay? Because one of the things that, let me back up for just a second. One of the things that I have not mentioned that I hope is kind of coming together for you, even though I haven't mentioned it, is that cocaine and the amphetamines are dopamine agonists. They mimic the actions of dopamine. And so just now when we talk about the ability of the amphetamines to enter the presynaptic neuron and then themselves be released from that presynaptic neuron would be akin to releasing dopamine into the synapse, okay? Because it's an agonist. It's mimicking the actions of dopamine, okay? So briefly, let me go back. First thing they do, which they share in common with cocaine, blocking the reuptake of dopamine and the other monoamines into the presynaptic neuron, but also blocking the autoreceptors. The second thing that they're able to do is to increase the spontaneous leakage of neurotransmitter into the synapse, okay? The third thing that amphetamines do to produce their actions is that they increase the quantal release of neurotransmitter into the synapse, okay? So remember, when an action potential arrives at the end of an axon terminal, that causes synaptic vesicles to burst open to dump neurotransmitter into the synapse. And there's usually a certain amount or quantity that gets dumped into the synapse, okay? And so what amphetamines are able to do is to increase the quantity that would ordinarily be released after the arrival of an action potential, okay? And then the fourth thing here, the amphetamines are actually able to interfere with MAO, or monoamine oxidase. Monoamine oxidase is an enzyme that's responsible for breaking down some of the catecholamines or the monoamines in the synapse, okay? And so that's the fourth thing. So let's just recap very briefly. They're able to block the reuptake of these neurotransmitters, dopamine and the other monoamines, into the synapse. They block the autoreceptors, okay? 2, they increase the spontaneous leakage of neurotransmitter into the synapse. 3, they increase the quantal release of neurotransmitter into the synapse. And 4, they're able to interfere with or block monoamine oxidase, which is one of the enzymes that's responsible for breaking down dopamine and the other monoamines in the synapse, okay? And so when you look at these four things, or consider these four things or four ways that the amphetamines are able to produce their effects, realize that what they are doing is increasing the amount of neurotransmitter in the synapse. They are blocking the reuptake. They're increasing spontaneous leakage. they are increasing quantal release into the synapse, and they are interfering with the enzyme that would ordinarily break down the neurotransmitters. So all of those things result in more dopamine and monoamines in the synapse producing actions. Okay? All right, so let's talk a little bit about some of the effects. Obviously, amphetamines will elevate mood. One of the things that we're going to talk about, I've already mentioned it really, but we know that they elevate mood, but the amphetamines, as part of the back end of its use, is to cause that depression. So they elevate mood on the one hand, but when an individual is withdrawing from these, then you have the depression, the crash, the letdown. Okay? Now, unlike cocaine, amphetamines tend to improve the performance on tasks that require sustained attention and concentration. Okay, and so a little bit later in the chapter, we're going to talk about why amphetamine-like drugs are useful in treating attention deficit hyperactivity disorder. Okay, the amphetamines also produce EEG signs of arousal. That's electroencephalogram. So they increase electrical activity in the brain. They're indicative of arousal. Okay. We've already talked at the top of the chapter about the fact that these drugs stimulate the sympathetic nervous system. And so remember, they're called sympathomimetics. They mimic activation. So you've got increased heart rate, increased blood pressure, increased respiration, diversion of blood flow from the digestive processes to the large organs. Okay? So let's move to the peripheral nervous system. Some of the effects there and some of the effects of amphetamines on performance in general. Okay, we've already mentioned that amphetamines will delay the onset of fatigue. Okay, so this would have implications again if an individual is trying purposely to stay awake, but we know that amphetamines a long time ago were used with soldiers. We know that there have been some histories of truck drivers with amphetamine use. Now realize, for a lot of these things now, they certainly are not used for those, not used for those purposes, and there would be drug tests on the job for truck drivers and other things like that, and so you would not see this widespread use as you would have decades ago. Okay. We know that the amphetamines dilate the bronchi, the bronchial tubes, because that's part of the stimulation of the sympathetic nervous system, that increased respiration due to the dilation of the bronchial tubes, that decreased airway resistance. Okay, like cocaine, amphetamines can constrict blood flow. So because it constricts blood flow, can constrict the nasal mucous membranes. You don't hear an awful lot about people snorting or sniffing the amphetamines, but that is another potential mode of administration for them. So that is as a mode, but it's just not as popular as some of the other modes of or routes of administration for the amphetamines. Tend to decrease appetite. Okay, tolerance develops to the appetite suppressant effects in general. It does. So one of the things that we often observe with children who begin their ADD, ADHD medications, Ritalin, etc., that they often will have a significant loss of appetite. Usually once they've become accustomed to that, blood levels are pretty steady, or the doctors tweak the dose, usually the appetite will return to some extent, but you often see reduced appetite when a person starts those types of medications. But certainly you see effects on appetite, and we're going to talk about effects on eating in general when individuals are taking amphetamine drugs, cocaine. Okay. Because the amphetamines can delay the onset of fatigue, you can have improved athletic performance because you have the delayed onset of fatigue. It means the individual can train longer, okay, before they become tired. And so that could offer them some advantages in terms of athletic performance. Okay. So let's talk a little bit about amphetamines, preference and tolerance. Users prefer methamphetamine to amphetamine. Okay, why? Okay, so we've talked a bit about stimulants just in general, the last couple of chapters, caffeine, nicotine, the psychomotor stimulants here. One of the things that we've said that's common to those drugs is that they stimulate the sympathetic nervous system, increase heart rate, increase blood pressure, increase respiration, the diversion of blood flow from the digestive processes to the large muscle groups. Okay, and so you've got the activation of the fight flight response. Now, if an individual is desiring to get high, okay, you really don't want your fight flight response activated to feel like you've got to fight or flee. Okay, and so one of the ways that methamphetamine differs from amphetamine is that methamphetamine does not seem to stimulate the sympathetic nervous system to the same extent as the other psychomotor stimulants. And so an individual using methamphetamine, although it's still quite dangerous, made with some very, very dangerous things, but an individual using methamphetamine would be able to experience the high without the adverse or the unpleasant effects that are associated with activation of the fight-flight response. So you're not going to get that racing heart and just feeling like, that panicky feeling that would be associated with the acute stress responses that are associated with activation of the fight-flight response. Okay. We know that acute tolerance is associated with amphetamine use. So there's a difference in the effects that are experienced when the blood levels of the drug are rising versus when the blood levels of the drug are falling. Okay, and so in terms of the the high that they're experiencing and so forth. So I generally don't ask you a lot about that. So acute tolerance to the pleasurable effects can occur within one administration or with repeated doses in a single setting. Okay, because one of the things that we're going to see, amphetamine, the effects are longer lasting than cocaine, and so this is a case where you may see an individual that are doing what we call amphetamine runs, where the drug is being administered roughly every 4 hours or so. Okay, but tolerance develops to the euphoric effects or the high that they're seeking. Okay, I think that I will stop here and I will pick back up on this slide, the amphetamines and some of the dose-dependent effects.